Our office is a state-of-the-art office. We're heavily invested in technology. We're heavily invested in comprehensive treatment in the same day for patients. Instead of coming back 3 and 4 times, we can accomplish in 2 hours what would take maybe 2 or 3 visits in other cases. The standards of care have changed where procedures done by general practitioners have to be as good as specialists. The quality of the images that the Kodak allows me to treatment plan, absolutely impossible to do without the cone beam machine. I'm able to now gather information in such a way that I can confidently treat them in my office and have excellent results, or refer them knowing that they're beyond my scope of care. We had 2 different traumas. The little girl that's getting married in 5 weeks, we were able to treatment plan and perform the same day a procedure that allowed her to get an implant that will serve her on her wedding day, which is 40 days away, whereas that would have been impossible in other times. Sending her out to an imaging center for a lower resolution image that wouldn't allow us to make decisions based on what is at hand. What do we need to do right now? A lady who had been previously treated by an endodontist in Arizona, and she lives here, and she was having a slowly progressive, painful symptoms, but it wasn't associated with any specific tooth. And we were able to find the area of problem and treat that one canal, resolve her symptoms, and at the end of the day, instead of having a brain tumor, which she was afraid of, she had a small infection, which resolved nicely. Absolutely impossible to do without the cone beam machine. This is a patient of mine who presented in April after suffering. He's a professional inline skater, trick skater. The first thing you do when he shows up is we did a Panorex. Clearly, he has a midline fracture here. You can see clearly there's a condylar fracture here. The question here is, how severe is this area, which is not easily imaged by any other way? How severe is this? Well, we need to take a scan to see that. In the case of the Kodak, we're able to see things coming at us. This tooth right here, for example, is clear to see. It was vertically fractured. It has since been removed and successfully healed. We're planning on doing an implant with that. You can actually see by moving these dots, you can visualize the trough and customize it to be able to see different areas better. We were able to take 3 scans and put them on top of each other. You can see the ghost images of the lower teeth here. Here's his upper arch. Here's the contralateral side. The tooth was fairly mobile, but the entire buccal plate complex was loosened with the tooth. This is his lower scan. You can actually clearly visualize the fracture going right down through the symphysis of his lower jaw. Almost losing. We were able to maintain vitality of this tooth currently, doing some splinting, some good apposition with bony plates. Blood supply is being maintained. The bone is not macerated. The buccal plate is intact. And so we were able to do that. He still has these teeth today. Being able to go back from Panorex to a cone beam, back and forth at the same time on the same machine. You just can't live without it once you have it. One scan will take you essentially from premolar to premolar, or from premolar to tuberosity. You hook the 3 together, you've got an entire arch at the same time. When you're explaining to the patient what are their options, it makes it so much easier to be able to say, this is your tooth and you're not going to be able to keep it, and this is the reason why. An implant is your best case here. Patients also appreciate that we have a firm foundation in technology to give them answers instead of possibilities. That is, at the end of the day, why I made the investment. Confidence, treatment planning, and final results.